This topic is latex allergy. Pathophysiology. This is an exaggerated, immune-mediated reaction. It's triggered by exposure to products that contain latex, a type of natural rubber. Repeated exposure can be from inhaling the proteins from the natural rubber latex or repeatedly coming into contact with it. There are two types of allergy: Type 1 hypersensitivity and Type 4 contact dermatitis. Risk factors. Asthma. Inhaling the latex protein can cause severe asthmatic reactions and other asthma symptoms. Clients can even develop occupational asthma from latex exposure. The client will have asthma symptoms at work, and those symptoms will gradually improve when they are away from work. Other risk factors include allergic rhinitis and other allergies, and prolonged or repeated exposure to latex, like with healthcare workers, because there is latex in gloves, catheters, and other supplies. Also, clients with a history of multiple surgeries, like with spina bifida, or clients with multiple exposures to latex-containing supplies, like with self-catheterization. Some food allergies share cross-reactivity with a latex allergy: banana, papaya, avocado, and kiwi. Diagnosis. This is done through health history. Are they at risk? What do they do for work? And have they had a reaction before? We'll do a physical examination, observing for a reaction or contact dermatitis. A skin patch test, you can see this in the image. This tests for the cause of contact dermatitis. Patches are attached to the skin for about 48 hours, and then the skin is assessed for a reaction. There's also the skin prick or scratch test. Some latex serum is placed in a prick or a scratch in the skin. This tests for an allergy to airborne latex and food allergies. Results appear more quickly than with the patch test. Clinical features of the Type 1 hypersensitivity. This is caused by the body's antibodies to the plant proteins in natural rubber latex. It is an immediate reaction. The latex protein can enter the client's system in many different ways: via skin, mucous membranes, inhalation, or the bloodstream. The client will develop hives, as shown in the image here: skin redness, swelling, respiratory distress, laryngeal edema, asthma, dysrhythmias, hypotension, anaphylactic shock, and even death. Clinical features of the Type 4 sensitivity, contact dermatitis. This involves the immune system. This is a hypersensitivity reaction caused by the chemicals that are used in the production of latex gloves. This has a delayed reaction or onset. The reaction generally happens 6 to 48 hours after exposure. It develops a localized skin reaction. You can see an example here in the image. There's dryness, itching, and cracking of the skin, redness and swelling. It may be compared to what a reaction to poison ivy would be. It may even produce blisters on the skin that ooze. Treatment for Type 1 acute hypersensitivity. This will include what we do for anaphylactic shock: epinephrine, IV fluids, and vasopressors to help with the blood pressure and hypotension. Corticosteroids for their anti-inflammatory and immunosuppressive properties. We will want to prepare the client for possible intubation, and we will monitor the client for several hours. Treatment for the Type 4 contact dermatitis. Avoid the use of latex-containing products. Thoroughly wash and dry the hands. We'll instruct the client to do this if they come into contact with latex. And we will also want to do this when we care for them, to not accidentally expose the client to latex on our hands. If the client has to come into contact with latex, they can use a water or silicone-based lotion as a barrier. They should not use oil or petroleum-based products. Those will break down the latex product. If the client does develop a skin reaction, to provide comfort, they can use compresses that are cool, an antihistamine, or hydrocortisone cream. Nursing interventions. We'll instruct the client to avoid latex, and we will avoid latex when we care for them. We'll encourage the client to carry an epinephrine pen, pictured here. We'll remove all latex-containing products from the client's room. The client will want to avoid foods that share cross-reactivity with a latex allergy, like avocados and bananas. And we can encourage the client to wear an allergy alert identification, like a bracelet, or carry an alert card. We want to encourage the client to alert all providers of the allergy, the doctor, dentist, pharmacist, or chiropractor. Nurse teaching, latex-containing items. Now, many hospitals have moved away from latex-containing items, but some still remain. Here is a list of hospital items that may contain latex: elastic wrap bandages, urinary catheters, gloves and tourniquets, the medication vial stoppers, ECG patches, and blood pressure tubing. We can also find latex items in the household. Household items that may contain latex include condoms and balloons, incontinence pads, elastic waistbands on clothing and undergarments, envelope glue, erasers, and rubber bands. Latex allergies can affect us and our clients. We want to keep them and ourselves safe.